What's up? It's me, Boy Skinny Penis, aka Ricky. But today I'm gonna be playing Surgery Squad, as y'all can see on the screen. This is a surgery game, and I played one surgery, and it was like carpal tunnel surgery. Oh my god. It made my wrist feel so weird, I didn't like it. And I was like, this would make a really good YouTube video. So
Welcome to Surgery Squad's virtual hair transplant. I'm Dr. Susie,
What's
and
up,
I'll be
Susie?
assisting you with this surgery today.
Aw,
A hair
so
transplant
nice.
is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site.
Nice.
Although hair transplantations are typically...
Didn't Jeffree Star get hair transplant for I think he did. That's why I clicked on it. I thought of Jeffree Star.
typically used to treat male pattern
I watched that video.
and restore eyebrows, beard, or chest hair. They can also be used to fill in scars caused by accidents or surgery. Today, we'll be using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking before and after the surgery can also result in poor graft survival.
Understandable.
To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent
He looks like a 6-year-old drew his hairline on. Poor guy.
any infection. I think you can handle that.
Okay. Oh, what's this? Oh, my. Can I draw like a penis? Wait. Did I apply bacterial shampoo? Oh, I can draw it anywhere? Whee! I think I'm just supposed to apply it here. I can't see because Susie's in the way. Yeah, okay, we're done. Click and drag to work up a good lather. Okay, this is fun. When you get hair transplant surgery, because I have ponytail spots from me having a ponytail in for a while, I guess we're gonna find out any questions that I have. I'm not gonna get a hair transplant surgery. I just need to chill with putting my hair up. You know what I mean?
So fresh and clean.
Oh.
Thoroughly rinse the patient's hair, and we're ready to get started.
He should have done this before. You nasty. Oh my god, the lag. It's freaking out on me. I have good Wi-Fi, so it's not me either, because my screen's doing good. Am I still recording? Yes. We're just gonna be done with that. It's too laggy.
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Nice! Outline. I said outline. There we go. Can I draw anything on it? My god, your poor hairline. Dog. Okay.
That looks good to me.
Oh, it fixed it for me.
Let's prepare the donor site. We'll begin by trimming the patient's hair in that area.
His head's got a big ol', I'm pointing as if y'all can see where I'm pointing, but right here it's not proper. Okay, shave. Oh, that sound in my ear doesn't sound very nice. It kind of, I like the drill from the dentist. I'm taking a old, small, tiny section.
Now that the patient's hair is trimmed down, we'll need to mark the area that
I thought we were just doing a tiny bit. Oh, we're doing all that? I thought we were just doing a small section right here. I didn't know that. Well, the more you know. And I think I just figured out why I wouldn't draw before, because I had both fingers on the touchpad as I was trying to draw. I keep looking over there. I need to look.
Great job! Inject
Thanks.
local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
Wait, is he awake right now? Oh. Don't jam it in the... That was loud in the mic. I apologize. Ooh, my head feels weird. Pause. Ooh.
Great, he won't feel a thing. Now we'll need to remove the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process.
Yes, he will. Oh. Oh, my eyes are watering. Ow! It's cutting through like it's butter.
Next, we remove the piece of scalp from the donor site. Make sure you have a good grip.
We're ripping it from it. It looks like cheese. Are we ripping it from his muscle?
Once removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
He's getting a neck lift. Oh, oh, my neck feels all weird. Stitch that up. Wait, so he's getting like a whole neck lift. His back is gonna be 6 inches higher. Not 6 inches. Oh, oh, oh no. Oh no. Protection. Jesus. We're ripping skin off. How does he not feel that? I mean, I know they gave him like a numbing agent, but like, Jesus. Christ almighty. There's no thread on that needle. Just saying. I actually got surgery on my ankle before. It wasn't fun. Oh. No.
Great, let's get to some dissecting. The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others. Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
Why does it make that sound? Oh! Sounds like you're cutting meatloaf. Like raw meatloaf.
Nice job. This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
Yeah. No. Think he already is. Jesus.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the recipient site.
Oh, so there's like teeny tiny... Jeez. That's what she's like. They're not careful in this game, are they? They're just like just stabbing holes in him. Like, oh, I can't cuss.
Perfect. With all of the incisions, it's getting a little messy there. Let's get that cleaned up.
Would have never thought. Just wipe you off, buddy. Jesus, this game is laggy. I'm also using a Chromebook, so that's probably part of the issue. Wipe all that away. Can be good as new.
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
Those are bigger than those holes. Oh, from over here. What? Oh, you just gotta click on it. It does it for you. Replacing individual hairs in his scalp. Or like forehead, I guess. That is such a tedious process. And why are they just scattering it around? I would go like in row order is what I would do. So like, oh, gross. Like individual little, that's so tedious.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the
Oh
remainder
my
of the recipient
gosh.
site. After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections.
I'd imagine so.
For up to a week after the procedure,
Nice
the
hairline.
donor area may be sore and some numbness may be experienced as well.
Yeah.
Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months.
No.
And that's hair transplant surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
Root canal and detached retina. Oh, which one should I do? I want to do one of these.
Welcome to
Who's
Surgery
he?
Squad's virtual root canal procedure. I'm the one and only Dr. Jeff.
Oh,
and I'll be
Dr.
helping
Jeff.
you with this surgery
You
today.
need that hair transplant surgery, my
A
friend.
root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth. During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal
my
it
tooth
to
feels
prevent
weird.
any
My
further
teeth.
infection.
Oh,
Our patient today
that's
is
the same
having a
dude.
root canal performed
No, he's
on their
different.
lower right second premolar. A dental professional may refer to this tooth as tooth 29. Before we begin, would you like
I
to
have pink
review some
bands.
of the common myths and misconceptions
yellow.
surrounding root canal treatment?
Let's review some common myths. I mean, why not?
I thought so.
Okay. Oh, I gotta read? I bet. During a root canal treatment, the tooth roots are removed.
Not even close. Remember, a root canal only involves cleaning, disinfecting, and sealing off the inside of the tooth. If the tooth's roots were removed, it would no longer have anything to anchor it to your jawbone.
Next. If a tooth doesn't hurt, it doesn't need a root canal treatment.
Not true at all. It is very possible for a patient to require root canal treatment if they have never experienced pain from a tooth.
Like,
This
my
is
gums
why
feel
having
weird right
routine
now on my
dental
bottom
exams
teeth.
is important.
Fun fact, I actually, pause this. I actually had, my canines removed, my baby canines, because they weren't coming out on time for my braces. And that hurt like absolute, like, oh my god, that hurt so bad. This one was fine. Well, I forget which one, but one of them was already like a little bit loose. That one was fine, but then they had to like rip the other one out, which was like pretty solid in my jaw. It hurt so bad. It's horrible. Pulling a tooth is a better option than having a root canal treatment.
Often patients may choose to have a tooth removed instead of having a root canal. While this may immediately seem like a simpler and more economical choice, it's often the opposite. Having a tooth extracted and replaced with a bridge, implant, or removable partial denture is not only a more costly option, but it also requires more treatment time.
Look at his mouth. Okay, let's just skip ahead. I can't handle this.
Let's move on.
Yes, indeed.
In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause.
It starts. Having a needle jammed into your mouth is literally the worst. I already hate needles. I would rather go through another ankle surgery than have that. Oh, a Q-tip?
Next, we can inject the local anesthetic. After
Oh,
the local anesthetic has taken
oh.
effect, the area should
You
become
know,
numb for a few
I
hours.
get jabbed the needle like in the roof of my mouth
Use the
because of my
syringe
canines.
to
But
inject the local anesthetic into the
oh,
patient's gums. Just
oh,
below the tooth, we'll be performing a root canal treatment on.
oh. Look at that. That's a meat needle. You're awake. You're awake for this. Oh, God.
Let's give our patient a few minutes to relax.
Yeah.
For their mouth to become completely numb.
Oh. Ugh.
Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
The what? What? What?
Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
Oh.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe.
Okay. How? I have to over to like press it in.
So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
You will not. Oh. Oh. No. Oh. That sound. They're drilling in your balls.
The next step is to clean and shape the tooth's canal using a root canal file. Go ahead.
You're awake for that. Well, you're gonna do what? You're gonna do what? Oh.
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection.
No.
Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
I beg your pardon? We're putting Clorox in my man's mouth. What?
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria...
He'll be dead by then. Call poison control. Oh, no music?
Great. Now use the suction to remove the bleach from the patient's tooth.
Have you ever gotten root canal? Let me know in the comments.
Next,
my
we'll
mouth
need
feels
to fill the
weird.
tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone. Let's see what you can do.
I can go. I have somewhere to be. I can't finish this.
Looking good. Looking good. A heated instrument is now used to remove the excess gutta percha.
Did you just jam it down in it? Oh, no problem.
Pack the gutta percha into the tooth canal using a plugger.
So he just has like rubber in his tooth now.
After the gutta percha has been placed, it is common that additional x-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on SurgerySquad.com.
Absolutely not.
After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication,
my body
such as
feels
ibuprofen or naproxen,
weak.
by brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking. it is possible to greatly reduce the need for a root canal. And that's a root canal. Why not check out some of our other amazing surgeries?
I'm gonna skip out on that crown
surgerysquad.com.
surgery. That crown surgery can go somewhere. I'm just gonna skip out on that. We're gonna do a couple more. We're gonna do a gallbladder surgery. Before you scrub in, this surgery may contain graphic procedures inappropriate for children or squeamish adults. I'm not a child nor an adult, so I guess I'm good.
Hello.
Oh. Hello. How you doing?
Hello, and welcome to Surgery Squad's virtual laparoscopic
What's up, Susie?
cholecystectomy. I'm Dr. Susie, and I'll be guiding you through this procedure today.
What's
Your
up?
gallbladder is basically a place that stores bile generated by your liver. As your body
My health teacher had
digests
this done.
fats, your gallbladder pushes bile into the common bile duct.
What's bile?
Down to your small intestines
I suck
to
at
help
health
digest
class.
them. Gallstones form when the bile hardens into small pieces that block the common bile duct.
Ooh.
These stones can consist of calcium, blood, and cholesterol, and they can cause moderate to severe pain, along with nausea and or vomiting. When this happens, it is called a gallbladder attack.
Oof.
Gallbladder removal is the best treatment for gallstones. There are two types: open gallbladder surgery and laparoscopic cholecystectomy.
Laparoscopic
Open
cholecystectomy.
gallbladder surgery
Hey, I said it
involves
for
incision
sure.
and removal of the gallbladder. It is performed when the laparoscopic method is not possible, or when complications or too much scarring from previous surgeries are found,
Nice.
or when the patient's blood won't clot well. This type of surgery causes more pain and longer
Just like cut
recuperation
him open
time.
like right there and then
A
take it out that way.
laparoscopic cholecystectomy, however, is the most common and often the best method to remove a gallbladder. It is where the gallbladder is removed through several small cuts in your abdomen.
Oh my body
The
still
surgery
feels
is
numb.
safe, and folks who have it normally recover within 1 week.
1 week?
There are a number of benefits to having laparoscopic cholecystectomy. Among them,
Like 500,000
being
people.
able to eat food without
Jeez.
pain in most cases. It eliminates any discomfort in the stomach lining, and in some cases, it relieves your upset stomach. However, if you have your gallbladder removed, you might experience chronic diarrhea, indigestion,
Oof.
trouble digesting, severe liver problems,
Oh, jeez.
fatigue, and rare but intense abdominal pain.
Ugh.
The patient waiting for us has
Oh,
been suffering
boy.
from pretty severe gallstone pain.
See it in
so
his
it is
face.
imperative we get his gallbladder out. Let's scrub up and
His
get
eyes are
going.
like yellow.
Our
Scrub
patient
up.
is already under general anesthesia, thanks to our nurses and anesthesiologists. We're going to make 4 small incisions,
Anesthesiologist.
1 right below the belly button, and 3 others right over the abdomen.
Ooh, you can tell a
First,
young kid
we'll
drew those.
disinfect the area where we're going to make our first incision.
Disinfect. With Kool-Aid. Oh, we've given him a nice tan. Actually, this isn't a nice tan. It's more of a Trump type tan. Which, by the way, is fantabulous. I'm kidding. There's sarcasm in that. Okay, sterilizer. We're sterilizing his whole stomach or just this area? I think it's just this area. Okay.
Good. Now take your scalpel and make a small incision right below his belly button.
Ooh. Ooh! You didn't warn me. Oh. No, you can't just, no. Oh, I thought you said small incision. Oh, we're stopping there. Okay. Ooh.
Nice and clean. We've got to see where we're going.
Jam that
First,
plug
we'll
in
put
there.
his abdomen
I almost
with
put
a
another
little
word
carbon
before plug.
dioxide to have some room to work.
He's not a balloon.
Just right. Now we'll
Hang
use
him up
this
at a freaking
laparoscopic
birthday party. I know
camera to help
CO2
us see
is
where we're going.
heavier than air.
We'll watch our monitor as we go.
So we just, yoink.
Slow and
Oh,
steady.
God.
You're doing a great job. And there it is.
Ugh.
I'll take care of the other incisions for our laparoscopic tools.
Susie, what are you doing?
Now that all of the trocars are in place, can you move the liver out of the way using the clamp so we can get to the gallbladder?
Why does that have teeth on it? Aren't livers and stuff, aren't those like
Excellent work. We have
fragile?
plenty of room to work now. Before making any incisions into the gallbladder, we'll need to clamp off the bile duct in 3 locations.
Oh yes, let's put these hair clips in there. Does it look like what I clip my hair with? Oh, God. I'm gonna be sick.
Great. Now use the scissors to sever it.
Edward Scissorhands. Snip.
I'll hold the gallbladder in place while you work to cut it from the liver. We'll use an electrocautery device to minimize bleeding.
Oh, it smells like steak. No.
Fantastic.
Does that smell like
Looks
crap?
you've done
Like,
this
if you
before.
open up a body, doesn't
One
that
last
stink?
thing. Let's take our clamp through the cut under the belly button and pull this guy out.
We didn't make an incision big enough!
Nice
Bloop.
work.
Is it that easy?
Scope shows that
You just
everything is
bloop
clean.
right out?
We've removed the gas, so let's close him up and get him to a fast recovery.
Staple? He's not an art project, he's a human! I know they use staples. I'm just baffled by the fact that they use staples.
Our patient is now in recovery, and he'll
Nice.
probably be there for a few hours. We'll send him
Nice.
home when he's able to eat something and
What a
drink
happy
fluids
guy.
easily.
These are
We'll
real.
also make sure he can walk on his
100%
own
real.
before we let him go. He'll probably have a small amount of diarrhea, and his doctor will probably have him on a special diet to follow for a few days.
As expected.
He should be ready to resume a normal life after a couple days of taking it easy. And that's how we perform a laparoscopic cholecystectomy. You did a great job today.
Aw.
While you're here, try your hand at one of our other surgeries here on surgerysquad.com.
Silicone breast implant. I kind of want to look at that. Because I always imagine like how much that like how much pressure and hurt that is, you know? I think I'll save that for another video. I think I'll make this into 2 videos. Yeah, I think I'm going to do that. Yeah, I think I'm going to just go ahead and record 2 videos so I can put them both out. That was it for today's video. If you enjoyed it and you want to see more, because I'll go ahead and post the other one that I'm going to make. If this hits 2 likes, I'll go ahead and post the other one. But thank you guys for watching. I really appreciate it. Like, comment, subscribe. Tell me something in the comments below. And tell me if you ever had any of these surgeries done to you before. I would love to know. I will see you guys in the next video. Bye.